Cancer. Just the word can send chills down your spine. It's a complex group of diseases, but at its core, cancer happens when cells in our body grow out of control. These abnormal cells can invade and damage nearby tissues and organs. Understanding cancer is crucial. Early detection often leads to better treatment outcomes. That's why we're diving deep into 3 types of cancer affecting the respiratory system: tracheal, bronchial, and lung cancers. While these cancers are relatively rare compared to other types, they can be serious and even life-threatening. Knowing the signs, causes, and treatment options can empower you to take charge of your health. Let's learn more about these cancers, how they're diagnosed, and the treatments available to fight back. Knowledge is power when it comes to our health. Before we delve into the cancers themselves, let's take a moment to understand the parts of the respiratory system they affect. This foundational knowledge is crucial for comprehending how these cancers impact our breathing and overall health. Imagine your respiratory system as a complex network of airways that carry oxygen-rich air to your lungs and remove carbon dioxide. This system is essential for life, as it ensures that every cell in your body gets the oxygen it needs to function properly. The trachea, also known as the windpipe, is the main airway that connects your voice box to your lungs. It serves as the primary passage for air to travel in and out of your respiratory system. It's like the trunk of a tree, strong and flexible, allowing air to flow freely. This flexibility is vital as it helps the trachea maintain its structure while accommodating the movement of air. Branching out from the trachea are the bronchi, 2 tubes that lead to each lung. These bronchi are the main passageways into the lungs, ensuring that air is evenly distributed. Think of them as the branches of the tree, dividing into smaller and smaller tubes called bronchioles. These bronchioles further distribute the air throughout the lungs, reaching every part. Finally, at the end of these bronchioles are tiny air sacs called alveoli. These alveoli are where the magic happens, facilitating the exchange of gases. These sacs are responsible for the crucial exchange of oxygen and carbon dioxide in your lungs. This process is essential for maintaining the balance of gases in your blood, which is vital for your body's overall function. Understanding this intricate system helps us grasp how tracheal, bronchial, and lung cancers can disrupt this vital process. By knowing how these parts work together, we can better appreciate the challenges posed by respiratory cancers and the importance of early detection and treatment. Tracheal cancer, as its name suggests, originates in the trachea, the windpipe. It's a rare type of cancer, accounting for less than 0.1% of all cancer cases. This cancer can develop in the cells lining the trachea, causing them to grow uncontrollably. It can obstruct the airway, making it difficult to breathe. While tracheal cancer is uncommon, it's important to be aware of its existence. Early detection is key to improving treatment outcomes. Bronchial cancer affects the bronchi, the 2 tubes that branch off from the trachea and lead to the lungs. It's often grouped with lung cancer because the symptoms and treatments are similar. This cancer can develop in the cells lining the bronchi, hindering the flow of air to and from the lungs. It can also spread to nearby lymph nodes and other organs. Like tracheal cancer, bronchial cancer is less common than lung cancer, but can be just as serious. Regular checkups and a healthy lifestyle are important for prevention. Section 5. Lung cancer. The most common. Lung cancer is the most common type of cancer affecting the respiratory system. It occurs in the lungs, specifically in the tissues of the lungs, often starting in the cells lining the air passages. This cancer can develop in different parts of the lungs and spread to nearby lymph nodes or other organs. There are 2 main types of lung cancer: small cell lung cancer and non-small cell lung cancer. Lung cancer is a serious disease, but advancements in treatment have significantly improved survival rates in recent years. Early detection and treatment are crucial for a positive outcome. Section 6. Causes. What leads to these cancers? The exact causes of tracheal, bronchial, and lung cancers are not always clear, but several risk factors can increase your chances of developing these diseases. Smoking is the leading cause of these cancers, accounting for about 90% of cases. The harmful chemicals in tobacco smoke damage the cells lining the respiratory system, making them more likely to become cancerous. Exposure to secondhand smoke, radon gas, asbestos, and certain chemicals can also increase your risk. Additionally, family history of these cancers can play a role. While avoiding all risk factors is not always possible, making healthy choices like quitting smoking, avoiding secondhand smoke, and testing your home for radon can significantly reduce your risk. Section 7. Recognizing the signs. Symptoms to watch for. Early detection is crucial for treating tracheal, bronchial, and lung cancers successfully. Knowing the symptoms to watch for can help you seek medical attention promptly. Common symptoms include a persistent cough that doesn't go away or worsens, coughing up blood or rust-colored sputum, shortness of breath, chest pain, hoarseness, wheezing, and unexplained weight loss. It's important to note that these symptoms can also be caused by other conditions, so it's crucial to see a doctor for an accurate diagnosis. Don't ignore persistent symptoms, especially if you have any risk factors for these cancers. Section 8. Diagnosis. Finding the cancer. Diagnosing tracheal, bronchial, and lung cancers involves a combination of tests and procedures. Your doctor will start by reviewing your medical history and conducting a physical exam. Imaging tests, such as chest X-rays, Connecticut scans, and MRI scans, can help visualize your lungs and detect any abnormalities. A biopsy, which involves taking a small sample of tissue for examination under a microscope, is often necessary to confirm the diagnosis. Other tests, such as bronchoscopy, which allows the doctor to examine your airways with a thin, lighted tube, and sputum cytology, which examines your mucus for cancer cells, may also be recommended. Early diagnosis is essential for determining the best treatment plan and improving the chances of successful treatment. Section 9. Treatment options. Fighting back. When faced with a diagnosis of tracheal, bronchial, or lung cancer, understanding the available treatment options is crucial. Treatment for these types of cancers depends on several factors, including the type and stage of cancer, the patient's overall health, and their personal preferences. Each case is unique, and a tailored approach is often necessary. Surgery is a common treatment option, especially for early-stage cancers. It can be a highly effective way to remove the primary tumor. This procedure involves removing the cancerous tumor and surrounding tissues to ensure that no cancer cells are left behind. In some cases, radiation therapy or chemotherapy may be used to kill any remaining cancer cells. These treatments can be critical in preventing the cancer from returning. Radiation therapy uses high-energy rays to target and destroy cancer cells, minimizing damage to surrounding healthy tissues. Meanwhile, chemotherapy uses powerful drugs to kill cancer cells or stop them from dividing and spreading. This can be administered intravenously or in pill form. These treatments can be used alone or in combination, depending on the individual case and the specific needs of the patient. A multidisciplinary team often collaborates to determine the best course of action. Targeted therapy, which uses drugs that specifically target cancer cells, offers a more precise approach with potentially fewer side effects. Immunotherapy, which boosts the body's own immune system to fight cancer, represents a groundbreaking advancement in cancer treatment. These newer treatment options show great promise and are continually being refined through ongoing research and clinical trials, offering hope for better outcomes in the future. Section 10. Prevention and Hope, a Healthier Future. While tracheal, bronchial, and lung cancers can be serious diseases, there are numerous steps you can take to reduce your risk and live a healthier, more fulfilling life. Quitting smoking is the single most important thing you can do to protect your lungs. Avoiding secondhand smoke, testing your home for radon, and ensuring your living environment is safe, and limiting exposure to carcinogens in the workplace are also crucial. Maintaining a healthy weight, eating a balanced diet rich in fruits and vegetables, and choosing whole foods over processed ones, and exercising regularly can further reduce your risk. Engaging in physical activities like yoga, jogging, or even a simple walk in the park can make a significant difference. Advancements in treatment have significantly improved survival rates for these cancers in recent years. New therapies and personalized medicine offer hope for even better outcomes in the future. Personalized medicine tailors treatment to the individual, increasing effectiveness. Remember, knowledge is power when it comes to your health. Staying informed about the latest research and treatment options can empower you to make better health decisions. By understanding these cancers, their causes, and the importance of early detection, you can take charge of your well-being and live a longer, healthier life. Embrace a proactive approach to your health and encourage your loved ones to do the same.